My name is Thea Verghese, and I did my presentation over the theory of planned behavior. So let's get started. So, what is the theory of planned behavior? The theory of planned behavior basically explains the thought process on a person's intention to take part in a specific behavior. There are three key factors that are indicators on whether a person will or will not act on that behavior. These factors are attitude, subjective norms, and perceived behavioral control. So we'll go into a little bit more depth on these factors in just a bit. So we have some key terms that are super important to the theory of planned behavior. So we'll start off with attitude. This is a person's perception or feelings toward a behavior, which can be either positive or negative. Negative. Example, I don't enjoy riding a bike. They feel negatively towards the action being riding a bike. Then we have beliefs. This is the inner thoughts a person has of their surroundings and others that they believe are true. An example of a belief would be, I think the weather today is good. Then we have perception. This is how a person interprets either an action or their surroundings given the environment that they are in. An example of how perception is used is smoking makes me look more mature, so I'm going to continue to do it, even though a person may know very well that this is a harmful and potentially addictive habit. Then we have behavior. This is the act of doing something, oftentimes in response to their environment or a situation. An example of behavior can be simply maintaining eye contact when speaking to someone. Then we have normative beliefs. This is what a person thinks that others expect them to do. So, an example may be a teenager avoiding wearing their bike helmet. Why? Because their friends don't wear one and they think it looks uncool. So, the thoughts of others kind of reflects what they will do. So, next we have culture. The common beliefs and values shared between a group of people that guide how their members interact with one another. An example of how culture is used is eating cultural foods that are healthy and nutritiously dense during family gatherings. Next, we have self efficacy. This is a person's belief in their own ability to successfully perform a specific behavior or task. An example of this would be I can quit vaping because I have resisted my own cravings before. So, although it can be a habit as strong as vaping, this is our belief that we can stop ourselves successfully. Then we have decision making. This is the process of choosing, oftentimes, between two or more actions or choices. An example of how decision making is used is deciding whether to or not to get the flu vaccine after researching both the benefits and side effects of the vaccine and also thinking about it with the information of your doctor. Then we have intentionality. Intentionality is being purposeful in making a decision or carrying out an action. So, how this could be used is exercising every day to improve my health instead of by chance or randomly, but for an end goal. Then, lastly, we have perceived power. This is a person's belief that they can control their situation or behavior. So, an example of how perceived power is used is me deciding that I will go to class because I have control of my own schedule, and because of that, I will plan out the best time that works for me. Let's go on. So, next, I created a concept map that goes over how this theory of planned behavior works and using those three key terms that I mentioned earlier. So, we have attitude, subjective norm, and perceived behavioral control. When all of these things are used, it goes straight into behavioral intention, which then ultimately leads into acting on a behavior. So let's start off with attitude. So we think to ourselves, is it good to do this behavior or bad? Then we go into subjective norm, which is what will people around me think of this behavior? And would they or would they not support me in doing this? Then lastly, we have perceived behavioral control. Do I have everything I need to complete this behavior successfully? Once we contemplate on all of these, we go into behavioral intention, which is kind of the contemplation stage, which we decide yes or no. And then after doing so, we act on that behavior. And when we do, it's either I did it or I didn't do it. So I wanted to kind of visualize how this concept map would work. So I wanted to give an example. So if you look right under behavioral intention, we see a man thinking about running a marathon. So let's run it through the concept map. So starting with attitude. Is doing this behavior good or bad? So is running a marathon good or bad? And for this sake, let's say it's a good. Then we have subjective norm. What do the people around me think of this behavior? And what would they support me? Do I have a support system? Is there people cheering me on? Because those things can have a huge impact on whether we do or if we don't run that marathon. Then lastly, we have perceived behavioral control. Do I have everything I need to run this marathon? Let's automatically we think of, do we have the right shoes? Do we have the right clothes? Do we have the right equipment? And then we also think of things such as transportation. Do we have the means to reach this marathon, and how can we get there? Once all of these are contemplated, we think, should I do it? And for this example, he does decide that he can do it. And then lastly, we can see that in the end, he does reach that finish line and he completes the marathon successfully. So I wanted to do an application on how the theory of planned behavior really plays a role in our everyday lives. So let's put this example into seatbelt safety. So using our three key factors, let's start off with attitude. We are going to use the belief of the outcome and evaluation of the outcome to kind of come to this conclusion. So wearing a seatbelt will keep me safe in case of a crash. Then we have evaluation of the outcome. I prioritize my safety and I want to keep myself from getting hurt. So having these positive attitudes regarding the outcome, which is preventing any danger, we have a higher chance of actually acting on that behavior. So that's very important. So then we look into subjective norms. So the normative beliefs. My family always wears their seatbelts whenever getting into any car. So our family and friends, their normative beliefs and what their actions kind of reflect on what we choose to do. And then we have our reason to comply. So since it's required by the law to wear a seatbelt, I don't want to be fined. So these social pressures, whether it being our friends, our family members, our law enforcement, these all play a role in a higher chance of actually acting on that behavior. So then we have perceived behavioral control. So, control beliefs. It doesn't take that much effort to buckle up before driving. And then we have perceived power. This is an easy habit to put in place. Having that thought process that we have high power and high control actually plays a deep correlation in a higher chance of actually acting on that behavior based on intention, not randomly, but by intention. And then we have Step 4, being behavioral intention. This is us deciding that I will wear my seatbelt every time I get into a car. So instead of just thinking, this is doing, right? And then lastly, we have acting on that behavior. This is when we decide that I will wear my seatbelt consistently and continue to do so and make that a habit, make that a part of our everyday life. So for the next part of this presentation, we're going to go over a journal article. So, the healthcare issue that we're going to be going over is healthcare empowerment for women. As we know, education and awareness in the healthcare world is essential. And yet, despite this, many parts of the world there is limited access to education, which actually leaves countless women uninformed about their reproductive health. So, with this study, the aim and the goal of the study is to see if higher education rates, which empower women in education making, reproductive freedom, and control and autonomy over their bodies, would have a positive impact. So, let's go over the study population. The race of the people participating in this study are Iranian. So we have a total of 488 participants in this study. And the location that the study takes place in is the Tehran University of Medical Sciences in Iran. So this is the capital of Iran where this is taking place. And then lastly, the gender is married reproductive aged women. So let's go over the theory application and how this plays into the theory of planned behavior. So using these three core components of the theory of planned behavior, women participated in the educational scenarios over a set period. And after 6 months, the researchers assessed whether the TPB-based intervention had a positive impact on their empowerment. So like mentioned previously in this presentation, we see attitude and subjective norm and then perceived behavioral control play a big role again. So let's go over how it plays a role in this journal. So attitude towards this behavior. Having access to educational resources would produce a positive impact on the women being more involved with their own healthcare options. Then we go into subjective norm. So producing a sense of community, which actually brings support to women and the family members in their lives. And then lastly, we have perceived behavioral control. How much access women had to the resources that they need, such as low-cost clinics, close clinics, which are proximity based, and then birth control or contraceptions that they may need. So let's go into the next two important phases of this theory. So we have behavioral intention and action. The final steps of this theory play a big role in the overall effectiveness of this study. For behavioral intention, women of this study actually actively deciding to make their own healthcare choices specifically regarding reproductive health. So this could be, for example, deciding to use contraception or meeting up with a gynecologist and etc., using those resources. Women actually felt more comfortable to seek out these resources that they needed. So providing that space, they felt more comfortable. And then lastly, acting on that behavior. Women that were part of this study actually felt more empowered in making their own healthcare decisions. We see that after the initial study and the survey that is completed 6 months after, the women actually felt more confident in making those decisions for themselves. And there was an increased communication with the healthcare providers, being the nurses, the doctors, the professionals that helped them get there. And ultimately, we can see that it supported the goal, which was to bring them more control in their healthcare, in their body, in their choices. So, in conclusion for this article, we see that the outcome of this study showed that when a theory of planned behaviors approach was used, there actually was a positive impact in the healthcare for these women that were part of the study. So in this study, we were actually able to determine that the most substantial factor was using the perceived behavioral control. So as mentioned before, by giving these women the opportunity to have cost-effective and close access to healthcare, whether that be through public transportation or walkable clinics, it would actually encourage them to use those resources, while in comparison, subjective norm actually had the least impact. And this is due to many reasons, such as community being a little bit more difficult to produce, but that's over time. And we see that actually in previous studies, we see that that was also a common pattern, being subjective norm. And then overall, we see that this method of framework actually was very influential in this environment due to the cultural and systemic barriers that are present. This study did take place in Iran, so we see that there some of these topics can be taboo just based on cultural barriers and etc. We see that by using this route, we can actually slowly reduce the stigma regarding female healthcare and work to provide a space that fosters education when it's the most important. By using this approach, women were able to become more engaged when it comes to their own healthcare and take control of their reproductive health. So I have my works cited here using my journal article and my textbook that we used. And thank you for listening in. Bye bye.